The hymen is a flexible tissue that can vary in shape, thickness, and size among individuals. The primary function of the hymen is not fully understood, but it is believed to protect the vaginal opening during development. The hymen is present in females before birth and usually begins to break down and change over time. The hymen is not an indicator of virginity or sexual activity. It can be stretched, torn, or even absent in individuals who have never engaged in sexual intercourse. The hymen can have various shapes, including crescent, annular, septate, or microperforate. Some females are born without a hymen, while others may have a more prominent or rigid hymen that covers a larger portion of the vaginal opening. The hymen can naturally wear away over time, through physical activities, such as exercise, tampon use, or even normal daily movements. In some cultures and societies, there is a social significance placed on the presence and condition of the hymen, often leading to harmful practices such as hymenoplasty or virginity tests. The hymen can be stretched or torn, during various activities, unrelated to sexual intercourse, such as sports, using a tampon, or inserting a finger into the vagina. The hymen is not an indicator of a woman's character, morality, or worth. Some individuals may experience pain, or discomfort during the tearing of the hymen, while others may not feel any sensation at all. In rare cases, an imperforate hymen can completely obstruct the vaginal opening, requiring a minor surgical procedure called hymenectomy for relief. The belief that an intact hymen should bleed during first sexual intercourse is a myth. Bleeding can occur due to various factors, such as insufficient lubrication or trauma. The concept of breaking the hymen is inaccurate. The hymen does not typically break, but rather stretches or tears gradually over time. The hymen does not regenerate after it has been torn or stretched. Once it is damaged, it cannot return to its original state. Some females may have a hymen that is naturally more open or perforated, making it less likely to tear during sexual intercourse. The appearance of the hymen can vary in color, ranging from pink to red or even brownish. Surgical procedures involving the hymen, such as hymenoplasty or hymenectomy, are controversial and can carry risks. The hymen does not provide a physical barrier to prevent the entry of foreign objects, including bacteria or tampons. It is not a seal. In some cultures, the presence or condition of the hymen is associated with notions of purity, virginity, or marriageability. The hymen is composed of connective tissue, blood vessels, and nerve endings. Some females may not be aware of the presence or condition of their hymen unless they experience symptoms or undergo a pelvic examination. Hymen variation is normal and should not be a cause for concern or distress. The hymen can be affected by hormonal changes during puberty, which may cause it to become more elastic or stretchy. The term hymen is derived from the Greek word meaning thin skin or membrane. The hymen is not a reliable indicator of sexual assault or abuse. Lack of an intact hymen does not negate the occurrence of sexual violence. Some individuals may choose to have hymenoplasty, a surgical procedure to reconstruct the hymen, for personal, cultural, or societal reasons. Hymen variation is not exclusive to cisgender women. Transgender men and non-binary individuals may also have a hymen. In some cases, a persistent hymen may require a minor surgical procedure called hymenectomy for medical reasons, such as recurrent pain or difficulty with menstrual flow. The hymen can naturally become more flexible and elastic with age and hormonal changes. The hymen can be examined by a healthcare professional during a pelvic examination, but it is not routinely checked without a specific medical indication. In some cases, a hymen that covers the entire vaginal opening may require surgical intervention to allow for menstrual flow or sexual intercourse. The hymen can be affected by certain medical conditions, such as imperforate hymen, hymenal septum, or hymenal tags, which may require medical intervention. The notion of the hymen as a symbol of virginity has historical and cultural roots but lacks scientific validity. The hymen should not be used as a criterion for judging a person's sexual history or character. Hymen-related myths and misconceptions can contribute to harmful practices, discrimination, and stigmatization of women and girls. The concept of virginity is a social and cultural construct that varies across different societies and time periods. Thanks for watching. Don't forget to like, comment, subscribe,